surgery, it is important to do a regular series of exercises designed to stretch and strengthen your muscles. Becoming stronger and more flexible before your surgery will help aid in your recovery. Do these exercises to the best of your ability without aggravating your symptoms, especially any pain that radiates into your arms or legs. Let's begin with some exercises that you can do in the comfort of your own bed, or if you are able, you can do these on the floor. Be sure to wear comfortable clothing. Let's start with focusing on normal breathing. Diaphragmatic breathing. Position yourself on your back with your knees bent. Inhale through your nose and exhale through your lips. As you inhale, feel your rib cage and belly expand. And as you exhale, feel your rib cage deflate. Repeat this 5 times. Maintain this normal breathing pattern while performing the following exercises. The first exercise is a bracing technique of your lower abdominal muscles to support your back. Abdominal bracing. Position yourself on your back with your knees bent. Exhale through your lips as you gently tighten your pelvic floor muscles, as if you are stopping urination, and gently tighten your stomach muscles as you draw your belly button down towards your spine, as if you are zipping up a tight pair of pants. Do not hold your breath. You can place your fingers just inside your hip bones. You should feel your muscles tighten up below your fingers. You should not feel the muscles push out into your fingers. Hold for a count of 5. Repeat this exercise 10 times. As this gets easier, progress to doing this in a seated and standing positions. It is very important to use this abdominal bracing technique while performing the following exercises. Let's begin with glute sets. While lying on your back with your knees bent, brace your abdominals and then squeeze your buttocks. Hold for a count of 5. Repeat this exercise 10 times. Let's move on to heel slides. While lying on your back with your knees bent, brace your abdominals and then slowly slide one heel forward on the bed and then slide it back. With your abdominals braced, you should not feel your pelvis rock forward or tilt from side to side. Repeat the heel slide 10 times and then switch legs. You're now in the position to do quad sets. With one knee bent and your other leg straight, brace your abdominals and simply tighten your top thigh muscle of the straight leg by pressing the back of your knee into the bed. Hold for a count of 5. Repeat 10 times and then switch legs. From here, we can do straight leg raises. With one knee bent and your other leg straight, brace your abdominals and then slowly raise the straight leg 8 to 12 inches from the bed, keeping the knees straight. Hold for a count of 5. Repeat 10 times and then switch legs. Remain on your back for this next exercise. The bent knee fallout. With one knee bent and your other leg straight, brace your abdominals and slowly rock the bent knee out. Be sure your pelvis does not rotate. Repeat this movement 10 times. Restabilize your pelvis and repeat with your other leg. Now let's try marching. Laying on your back with both knees bent, brace your abdominals and slowly bring one knee towards your chest, then lower. Be sure your pelvis does not roll from side to side. Keep your pelvis still. Repeat 10 times with one leg and then switch to your other leg. Moving on to the bridge. Laying on your back with your knees bent, brace your abdominals and then slowly raise your buttocks from the bed. Hold for a count of 5. Repeat 10 times. If you're able, position yourself on your hands and knees for the next exercise. Hip extension on all fours. From this position, brace your abdominals and then slowly raise one leg behind you with the knee slightly bent while keeping your trunk rigid. Do not arch your neck or back. Hold for a count of 5. Repeat 10 times with each leg. Roll onto your side for the next exercise. Clams. Lying on your side with your knees slightly bent, brace your abdominals and slowly rotate your top knee towards the ceiling while keeping your ankles together. Do not let your hips roll back. Hold for a count of 10. Repeat 10 times on each side. Let's work now on strengthening your upper body with chair push-ups. Find a sturdy chair with armrests. Sit on the edge of the chair and place your hands on the armrests. Push up until your arms are extended. Then sit back down. Repeat 10 times. Now gently stand up and stand behind your chair. Hold onto the back of the chair. Brace your abdominals for the following exercises in a standing position. We will begin with heel raises. Lift both heels off the floor, going up onto your toes and then lower back down. Repeat this 10 times. Continue standing behind the chair and let's march in place. Raise each knee and foot off the ground and lower it back down. March in place 10 times with each leg. Moving on to side leg lifts. Stand tall and slowly lift your leg out to the side, keeping your toes pointing forward and slowly lower back down. Repeat 10 times with each leg. Now, if you can tolerate it, let's do squats. Hold on to the back of the chair and squat down 6 to 8 inches like you were going to sit into a chair. Then return to a full standing position. Repeat 10 times.